You checked yourself this morning and noticed something different. The skin looked a little off, maybe dimpled, maybe slightly thickened. You thought, it's probably nothing. Just aging. Stop right there, because that exact thought has cost thousands of women their lives. Most women know to check for a lump, but almost nobody talks about the skin. And that's exactly where early warning signs hide in plain sight, visible right on the surface, and still get completely ignored. Here's what nobody tells you. Some of the most aggressive forms of breast cancer don't even start with a lump. They start with the skin, and if you don't know what you're looking for, you'll miss it every single time. So let's talk about what your skin is actually trying to tell you, because some of these signs look so ordinary, so harmless, that you'd never guess they could be serious. The first one almost everyone dismisses. You notice a small area of skin on your breast that looks dimpled, like the surface of an orange peel. It might only be visible when you lift your arm or change positions. It comes and goes. You assume it's just a bra issue or aging skin losing elasticity. But that texture, called peau d'orange in medical terms, is one of the earliest visible signs of a specific type of breast cancer. It happens because cancer cells can block the lymphatic vessels just beneath the skin, causing fluid buildup and that characteristic dimpled look. It's not dramatic. It doesn't hurt. But it is serious. And most women who had it say the same thing. I noticed it weeks before I said anything. Now here's the sign that looks the most harmless of all. And that's exactly why it's the most dangerous. Redness. Just redness. On one breast. No lump, no pain, no fever. You might think it's a rash, maybe a reaction to a new lotion, maybe just irritation from the fabric of your shirt. So you wait, you apply some cream, it gets a little better, then comes back. What you might not know is that inflammatory breast cancer, one of the fastest growing and most aggressive forms, almost always presents with redness first. Not a lump, just warmth and redness on the skin. It spreads fast. And the survival window is narrow. The difference between a rash and a warning sign, a rash typically improves in a few days. If redness on your breast has been there for more than 2 weeks and you can't clearly explain why, that is a reason to call your doctor. Not next month, this week. But wait, the sign most women are most likely to confuse with aging is coming up next. And it's one of the most commonly missed. Your nipple, not a lump around it. The nipple itself. Has it started turning inward when it didn't used to? Has the skin around it become slightly scaly, flaky, or irritated, almost like mild eczema? Is there any discharge, even occasional, even small, that you haven't been pregnant or breastfeeding for? Each of these alone could mean nothing, but each of them can also be an early sign of changes happening beneath the surface. Nipple retraction, where the nipple pulls inward, happens when tissue beneath it is being pulled by something growing. That something doesn't have to be large to cause it. Paget's disease of the breast is a rare but real condition that starts exactly like a skin rash around the nipple, itchy, slightly crusty, easy to dismiss as a skin condition, but it's often linked to underlying breast cancer. Dermatologists sometimes catch it, but only if you go, here's what's going in most households right now. A woman notices a change, she's not sure. She tells herself she'll watch it for a few more weeks. A few weeks becomes a month. A month becomes 3. And then she finally goes, and the conversation changes completely. The women who catch things early are not the ones who had more obvious symptoms. They're the ones who acted faster on the subtle ones. You do not need a lump to justify an appointment. Skin changes alone are enough. Mention them. Show them. Ask about them specifically. Because sometimes a quick examination doesn't include close inspection of the skin unless you bring it up. Now here's something else that almost never gets discussed. Breast skin changes don't always happen on the front of the breast where you'd easily notice them. They can appear underneath, near the armpit, along the lower fold. Areas that are harder to see, harder to examine, and easier to overlook in a rush self-check. This is why position matters when you check. Standing with your arms at your sides shows you one picture. Raising both arms above your head shows you a completely different one. Leaning slightly forward changes the way the skin falls, making dimpling more visible. Lying down changes it again. A proper check isn't a quick look in the mirror. It's a deliberate scan in multiple positions in good light of the entire surface area, including the skin you almost never look at. If you've had any of these changes and you've been putting off saying something because you're not sure if it's worth it, let that hesitation go right now. You are always worth it. A 5-minute conversation with your doctor is always worth it. A referral, an ultrasound, a mammogram, all of it is worth it. Because the alternative, waiting until there's no question left, is the outcome nobody wants. The women who lose the most time are not the ones who overreacted to something minor. They're the ones who waited until it was impossible to ignore anymore. Don't be that woman. Your skin is communicating with you constantly. It shows you inflammation, change, stress, long before other symptoms appear. On your breast, that communication is especially important to listen to. Not every change is cancer. In fact, most aren't, but some are, and the ones that are caught early, the outcomes are profoundly different from the ones caught late. So the next time you notice something and your first instinct is it's probably nothing, ask yourself, what if it's something? Because the cost of checking is almost zero. The cost of not checking can be everything. Most people go through their entire lives believing that breast cancer always starts with a lump. That belief alone has cost countless women their chance at early detection. Because while everyone is searching for something they can feel, the real warning is sitting right on the surface, visible to the naked eye, hiding in plain sight. Your skin is not just a covering. It is a living, reactive layer that responds to everything happening beneath it. When something changes deep in the breast tissue, when cells begin behaving abnormally, when lymphatic vessels get blocked, when inflammation starts building, the skin reacts first. Before the lump forms, before the pain starts, before any scan would even pick it up clearly. The skin already knows. The most overlooked sign is a texture change that doctors call peau d'orange, a French term that literally means orange peel skin. The surface of the breast begins to look dimpled, slightly puckered, almost like the skin of an orange. It is not dramatic. It does not hurt. It does not feel hot or look inflamed. It just looks a little different from what it used to, and that is exactly why it gets ignored. What is actually happening beneath that dimpled surface is deeply significant. Cancer cells, as they grow, can invade and block the tiny lymphatic channels that run just under the skin. When those channels are blocked, fluid begins to back up. The surrounding tissue swells slightly. The small ligaments that connect your skin to the deeper breast tissue get pulled tight by that swelling. And that pulling is what creates the dimpled, uneven texture you see on the surface. It is your body physically showing you that something is wrong underneath. Here is what makes this sign so dangerous. It is not constant. It appears in certain positions and disappears in others. You might only see it when you raise your arms above your head, or when you lean slightly forward, or when you press your hands firmly on your hips and flex your chest muscles. In a normal standing position with arms relaxed, it can look completely invisible. So if you are only doing a quick check in the mirror before getting dressed, you will miss it completely every single time. This kind of skin change is most commonly associated with inflammatory breast cancer and locally advanced breast cancers, both of which move quickly and leave very little margin for delay. These are not slow-growing wait-and-watch situations. Every week matters. Every month of delay genuinely changes what treatment options are available and what outcomes look like. The women who notice this sign early are not the ones with medical training. They are the ones who look carefully, in good light, in multiple positions, with the specific intention of checking their skin, not just feeling for a lump. The skin always speaks first. The only question is whether you are paying close enough attention to hear it before it is forced to scream. You said, expand key point 2 in 500 words. Please hooked up viewers, but don't subheadings or ending sentence. Every single like will very informative and affect my audio. Most women who are eventually diagnosed with inflammatory breast cancer say the exact same thing when they look back. They thought it was a rash. They thought it was an allergic reaction. They thought the underwire of their bra was irritating the skin. They waited. They applied cream. They gave it time. And that time, those weeks of assuming it was nothing, is often the most expensive time they ever lost. Redness on the breast is one of the most psychologically easy symptoms to dismiss because the brain immediately reaches for the most harmless explanation available. Rash, irritation, heat, friction. Your mind is wired to protect you from panic, so it hands you the most comfortable answer first. And in most cases, that comfortable answer is correct. But in some cases, in the cases that matter most, it is dangerously wrong. Here is what separates ordinary skin irritation from something that demands urgent attention. A rash caused by fabric, lotion, sweat, or mild infection follows a very predictable pattern. It appears, it peaks, and within a few days to a week, it begins to improve, especially if you change the irritant or apply a basic treatment. It does not stay the same. It does not slowly spread. It does not persist on one breast specifically, while the other remains completely unaffected. Inflammatory breast cancer does not follow that pattern. The redness it causes comes from cancer cells actively blocking the lymphatic vessels in the skin of the breast. the same mechanism that causes swelling and warmth. The skin becomes red, sometimes almost bruised-looking, often warm to the touch. One breast may appear visibly larger than the other due to the internal swelling. The skin can take on a heavier, thicker feeling, and none of this is accompanied by the fever or obvious infection signs that would make you think of mastitis or a standard skin infection. What makes this form of cancer uniquely terrifying is its speed. Inflammatory breast cancer does not grow slowly over years. It can progress from early signs to advanced stage in a matter of weeks. There is no slow window where you can afford to wait and see. The women who do well are almost always the women who acted on the redness within days, not months, of noticing it. The 2-week rule is not a medical guideline designed to make you paranoid. It exists because redness with a clear, explainable cause resolves within that window. If you are 2 weeks past noticing the change and the redness is still there, still on one breast, still not clearly explained, your body is asking for help and you owe it to yourself to listen. One more thing almost nobody talks about. Inflammatory breast cancer disproportionately affects younger women. Women in their 30s and 40s who are told they are too young to worry, too young to need a mammogram, too young for this to be serious. Age is not a shield. Redness is not always a rash. And dismissing it as one is a risk no woman should take. There is something deeply unsettling about the fact that one of the most visible, most accessible parts of the breast, the nipple, is also one of the most consistently ignored when it comes to early warning signs. Women examine. Women check, but most are checking for a lump somewhere in the tissue, running fingers across the breast in circular motions, pressing gently for anything unusual. Almost nobody is looking closely at the nipple itself. And that oversight is exactly where early signs quietly disappear unnoticed. Your nipple has a baseline, a normal appearance that belongs specifically to your body. Maybe it points slightly to one side. Maybe it sits flat. Maybe it has always had a small amount of texture around it. That personal baseline is actually your most powerful diagnostic tool, because any deviation from it, any change that you cannot explain, is your body sending a signal that something beneath the surface has shifted. The most alarming nipple change, and the one most commonly dismissed, is inversion. When a nipple that has always projected outward suddenly begins pulling inward, retreating toward the breast tissue, most women assume it is hormonal. They assume it is weight change. They assume it is just the body aging and shifting. What they do not consider is that nipple retraction happens when tissue beneath the nipple is being physically pulled by something growing and tightening in the deeper layers of the breast. It is not the nipple deciding to change. Something beneath it is pulling it inward. That distinction matters enormously. Then there is the skin around the nipple, the areola, which carries its own set of warning signs that look almost identical to common skin conditions. Flaking, mild redness, a slightly crusty texture that comes and goes, persistent itching that does not fully resolve no matter what moisturizer or cream you apply. Most women who experience this reach for a dermatology explanation immediately. Eczema, psoriasis, contact dermatitis. And sometimes that is exactly what it is. But sometimes it is Paget's disease of the breast, a rare condition where cancer cells from deeper within the breast migrate outward and manifest in the skin of the nipple and areola. It looks like a skin condition. It behaves like a skin condition. It responds temporarily to creams the way a skin condition would, but it is not. What makes Paget's disease particularly dangerous is the delay it creates. Women treat the surface symptom for months, sometimes over a year, before the underlying cause is investigated. By the time a biopsy is taken from the nipple skin, the cancer beneath has often had significant time to develop. The surface was showing the answer the entire time. It just looked too ordinary to take seriously. Discharge is another chapter entirely. Clear, cloudy, or bloody discharge from a nipple outside of pregnancy or breastfeeding is never something to normalize. A single episode, an occasional drop, something you notice once on your clothing and cannot explain. These are not things to file away and forget. Discharge can indicate a range of conditions from benign growths to malignancy, and the only way to know which one you are dealing with is to have it examined. Your nipple is not a separate concern from your breast health. It is a direct, visible extension of the tissue, ducts, and structures beneath it. And when those structures change, the nipple is often the first place that change becomes visible to you. Do not look past it. Do not normalize something new. Do not let a comfortable explanation stop you from asking the question that could change everything. Most women who do self-checks genuinely believe they are doing them correctly. They stand in front of the mirror, they look, they feel, they move on. They are putting in the effort. They are being responsible. And yet they are missing critical information every single time, not because they are careless, but because nobody ever told them that position changes everything about what you can and cannot see. The human breast is not a flat surface. It is a three-dimensional structure shaped by gravity, muscle, ligament, and tissue. And it behaves completely differently depending on how your body is positioned when you examine it. A dimple that is invisible when your arms hang relaxed at your sides becomes suddenly, unmistakably visible the moment you raise both arms above your head. A subtle flattening on one side that looks completely normal from the front becomes obvious when you lean forward and let the breast hang naturally away from the chest wall. These are not minor details. These are the differences between catching something early and missing it entirely for months. When you raise your arms above your head during a self-examination, you stretch the skin of the breast and change the tension on the underlying ligaments. If there is anything beneath the surface pulling on those ligaments, any mass, any area of abnormal tissue, any blocked lymphatic cluster, that pulling becomes visible as a dimple, a pucker, or an asymmetry on the skin surface that simply does not appear in a relaxed position. This is why clinical breast examinations always include this step. It is not ceremonial. It is mechanically revealing information that no other position can show you. Leaning forward is another position that almost no one includes in a home self-check, and it is one of the most revealing. When you place your hands on a surface and lean your torso forward so that both breasts hang away from the chest, gravity pulls them downward and outward. In this position, any asymmetry in shape, any area where the skin is being tethered or pulled, any difference in how one breast hangs compared to the other becomes visually apparent in a way that standing upright simply cannot replicate. Women have discovered significant changes in this position that were completely invisible in every other. Then there are the areas that almost nobody checks with any real attention. The underside of the breast, the fold where breast tissue meets the rib cage, is one of the most neglected zones in self-examination. It is harder to see, harder to position a mirror to examine, and easy to skip when you are moving quickly. But skin changes, dimpling, and thickening absolutely occur there. The area near the armpit is equally critical. Breast tissue extends further toward the armpit than most people realize, and lumps, skin changes, and swollen lymph nodes in that zone are missed constantly because the examination never reaches that far. Lighting is a variable that changes everything and costs nothing to fix. Harsh, direct overhead lighting flattens the surface of the skin and eliminates the shadows that make subtle dimpling visible. Soft, angled lighting, a lamp positioned to the side rather than directly above, creates shadows across the skin surface that reveal texture changes, slight depressions, and asymmetries that bright overhead light completely washes out. Examining yourself near a window with natural side light is one of the simplest, most effective upgrades you can make to a self-check that most women have never been told about. Lying down changes the examination entirely for a different reason. When you lie flat on your back, breast tissue spreads differently across the chest wall, and lumps or thickened areas that are harder to feel when standing become more accessible to the fingertips because the tissue is no longer compressed by its own weight. For women with denser or larger breasts especially, the lying down position is not optional. It is the position where the most information is available to the touch. A self-check done in one position in 1 minute in poor lighting is not a self-check. It is a ritual that creates a false sense of security. The women who catch changes early are not examining more frequently. They are examining more completely, position by position, zone by zone, with intention, with light, and with the understanding that their breast looks genuinely different from 4 different angles, and every single one of those angles is worth looking at. There is a particular kind of silence that happens in the weeks after a woman notices something different. She sees it. She registers it. Something in her knows it was not there before. And then, almost immediately, another part of her mind begins building a case for why it is probably nothing. That internal negotiation, that quiet back and forth between knowing and dismissing, is one of the most human responses imaginable. It is also one of the most medically costly. The relationship between early action and survival outcomes in breast cancer is not subtle. It is not a marginal improvement on paper that only matters in statistics. It is the difference between a conversation about treatment options and a conversation about how much time is left. Stage 1 breast cancer has a survival rate above 90% in most cases. Stage 4 is a completely different reality. And the gap between those two stages is often not biology, it is time. Specifically, the time women spend waiting before they say something out loud to someone who can help. What drives that waiting is almost never laziness or carelessness. It is fear wearing the costume of logic. The mind tells you that if you go and it turns out to be nothing, you will have wasted a doctor's time. You will have overreacted. You will feel embarrassed for being dramatic about a rash or a small skin change that turned out to be completely benign. And so you wait until the evidence is undeniable, until the sign is so obvious that there is no longer any room for the comfortable explanation. But by the time a sign becomes undeniable, it has usually been present for far longer than it should have been. Here is the truth that needs to sit with you. Doctors do not view early visits as a waste of time. A woman coming in because she noticed a skin change that turned out to be nothing is not an inconvenience. She is exactly the kind of patient the entire early detection system is designed for. The appointments that genuinely change outcomes are the ones that happen before there is any certainty. Before the sign is dramatic, before the lump is large, before the cancer has had months of uninterrupted time to grow while you were waiting for more proof. Younger women carry a specific and deeply unfair burden in this space. They are told repeatedly, sometimes by doctors, sometimes by the general cultural messaging around breast cancer, that they are too young to be at significant risk, that mammograms are not recommended until a certain age, that a woman in her 30s or early 40s with a skin change is almost certainly dealing with something hormonal or benign. That reassurance is sometimes correct, but it has also caused younger women to delay seeking help for signs that turned out to be exactly as serious as their instincts told them they were. Age is a statistical factor in risk. It is not a guarantee of safety, and it is never a reason to dismiss something your own body is showing you. Access is a real barrier for many women, and it deserves honesty. Not everyone has easy access to a doctor, affordable imaging, or a healthcare system that moves quickly. But even within those constraints, the first step, saying the words out loud, describing the change, getting it documented and on record, costs nothing and starts the clock in the right direction. A conversation with a nurse, a telehealth appointment, a visit to a community clinic. The act of reporting what you have noticed is itself a form of early action, and it matters even when the system around it is imperfect. The women who catch breast cancer early are not a different category of person. They are not more medically educated, more vigilant by nature, or somehow more attuned to their bodies than anyone else. The single thing that separates them is that when they noticed something, when that quiet internal knowing appeared, they acted on it before the comfortable explanation fully took over. They made the appointment while they were still not sure. They described the change while they still half believed it was nothing. And that half-believing, uncertain, slightly embarrassed early appointment is precisely the one that changed everything.